So I want to start by introducing our panelists. So we have Esther McCarthy and we have Gregory Leonardi. Gregory is a human services professional with nearly 2 decades of experience supporting individuals with intellectual and developmental disabilities. In his current role as a supervising community program specialist with New Jersey's Division of Developmental Disabilities, he leads a team that oversees home and community-based services, or HCBS, compliance, as well as electronic visit verification, or EVV, and quality assurance initiatives across multiple regions. He has helped drive key initiatives that bring technology into the lives of people with disabilities, including improving EVV compliance, supporting remote support implementation, and participating in a multi-state technology consortium. His work blends policy knowledge with practical solutions, all with the goal of creating systems that empower individuals and give them greater independence. Through his leadership, Gregory strives to combine regulatory expertise with a commitment to person-centered planning, ensuring services are both compliant and compassionate. You will also be given a certificate of attendance afterwards, where in a follow-up email with a link to this recorded webinar and the slides. And so without further ado, I would like to thank Gregory for being here and turn it over to you. Thank you so much.
And can you see the screen?
Perfect.
Perfect, thank you. So thank you for that wonderful introduction. My name is Greg Leonardi. Currently, I'm the unit director in the Waiver and Quality Unit, which is where our technology initiative is housed. Esther is the supervisor for the Service Review Unit, also in Waiver and Quality, and that's where assistive technology, as we know it today, is currently housed. So she's a great resource on here for any kind of current questions about assistive tech, requests, and so on. The webinar I have for you is about 20 minutes, and it's pretty high level overview. If you have any questions, again, please let me know at the end. I'll try to check that chat box as well. If you're like me and you think of a question, the second the webinar closes, just shoot me an email. My email will be on, I believe it's on the last slide, so you can copy it down from there. I believe some of you may have already seen one of these, so I did try to incorporate some new information. Hopefully, I touched on something that maybe we didn't discuss previously. So some quick objectives for today. First, I'm hoping to provide, again, a high-level overview of enabling technology and remote supports. And just to note, the language I'm using is in line with what other states who are tech-first use. I understand the manual currently states assistive technology, but we're looking into some revisions to sort of bring it more into alignment. And those revisions, I'm actually very hopeful will be out around November of this year. Secondly, we will review some current tech initiatives, which include our smart home and EVV. So EVV is not so much a new initiative, but it is a federal mandate that does incorporate technology to ensure individuals receive services when and where they need them, hopefully in turn reducing fraud. And then third, we will review some data and our next steps. Okay. So while our technology first kind of push, it sort of lined up with COVID. So COVID was not the sole reason for the uptick in technology that you can kind of see here on the screen, but it's prudent to just acknowledge that COVID obviously changed a lot of stuff, and it was one of it definitely was a variable in the state using more technology. The two graphs you see on the screen are the total number of requests, which is the graph you see on the left, and then the total dollar amount on the right related to our 3 technology procedure codes. So the reason I put this on here is you can already see that from 2019 through 2024, for most categories, we've seen a pretty dramatic increase with 2024 showing a very significant increase from 2019. Just the dollar amount alone for tech, in 2019 was under 100K. And now it's, I wouldn't be surprised if it's over 500K for 2025. So there's definitely been a big uptick. The increase does align with our increase in technology webinars, the smart home implementation that I'll talk about a little bit later, EVV, some pushes from our service review unit. So there's a lot that we've been kind of doing already with this. And, you know, we feel that all those variables kind of play a part in this uptick we're seeing. Okay, so enabling technology is refers to the tools and software designed to, you know, assist individuals with various disabilities. It includes smart doors, different sensors, and so on. And the graph you or the picture you see on the screen here kind of just touches on those areas. So it could touch on transportation. It could have something to do with communication, leisure, which I always stress during my webinars that that's a big one. We don't often always think about and put at the forefront, but it's something that we really should for our individuals. Sensors. So, I mean, that's, you know, smoke alarm, CO alarm, bed sensor, door sensor, so on and so on. Access, you know, fingerprints, doorknobs or keypads, whatever it may be in home automation, which is pretty popular in the general population, especially with items like Alexa. So what are some of the characteristics that we look for with enabling technology? So we want technology that promotes independence. We want services that encourage skill development. So we are not only looking for technology to be, we're not looking for technology to be the final solution. If we can find some sort of technology that could help the individual remain independent, but also teach them the skills that hopefully down the line they don't even need the technology, that's really our ultimate goal. And a lot of the providers, which I will touch on later, actually have incorporated that mentality into some of their proprietary software that they use. So technology is chosen based on personal outcomes and preferences. Technology supports do not require a medical professional's recommendation. I'm just going to repeat that. You know, they cannot require a medical professional's recommendation. So something very important we need to look at. And obviously, there's solutions that are based off of person-centered planning, aligns with, you know, home and community-based services, final settings rule. So we kind of just touched on this a little bit, but just some examples of enabling technology that we currently have in place, or that agencies are already using. We have the Ring doorbell. We have seizure alarm. So it's like a pad that goes underneath the individual's bed and can sense if they're seizing. Stove alarms, which I thought were pretty unique. I didn't know that they existed before I started this. You know, we went down this path. Blood pressure monitors, and I put it for leisure again. It's one of the things I'm passionate about. I have a family member under services, and I always feel like that's something we just miss. Smart door locks, medication dispensers, which is also, I think, something pretty unique. And then, of course, your range of sensors and two-way communication devices. So oftentimes when we talk about enabling technology, we sort of lump remote supports into it, but really they're two separate things, right? So enabling technology is the tech and remote supports is really the monitoring piece. So enabling technology can include remote supports. So what is remote supports? Remote supports is technology like video calls and messaging that provides assistance and guidance from a distance. It's meant to promote independence and inclusion by helping individuals with daily tasks and skill development, regardless of location. So again, the big point is that it's staff or certain providers that are able to help from a distance and don't need to be necessarily at the group home or at the apartment or whatever it may be. So what are some of the characteristics that we're looking at for remote supports? We needed to include the ability to send and receive real-time data. I mean, that's really the heart and soul of it. Something that we find interesting was the wireless technology. So, you know, a lot of homes aren't really wired, we could say, any longer. So we need to ensure that any provider or anything that we do, any services we put in place really has the ability to work with wireless technology, you know, off of Wi-Fi or some kind of other proprietary system that is wireless. And that's especially important when we're talking about, if somebody's renting an apartment, and we need like landlord permission to make any modifications and stuff like that, that's where wireless tech comes in play too. It's something that includes two-way communication, and that kind of ties into the first one, with support staff, whether they're paid or unpaid in real time, has emergency backup options in place. So obviously, we all know tech fails, right? So we need to make sure that if the tech does fail, that we have a backup plan, to bridge any gap that there may be. And again, the heart and soul of everything we do promotes independence and is person-centered. So what are some of the benefits of using remote supports with that enabling or assistive technology? So again, provides assistance with tasks and activities from a distance. So it allows individuals to live more autonomously. It allows for individualized approaches that address specific preferences, needs and preferences, flexible and customizable. It assists providers with navigating staffing shortages for DSPs. So obviously we all understand, and I'm sure those on here, I don't need to preach to how difficult it may be to find, hire, maintain DSPs. So while currently we don't have the ability for it to replace staff, we do have that goal in mind, and that is something we are striving to accomplish. It's something that's cost effective. So if an individual can meet a need with their budget through tech, that might be cheaper than having a DSP or something along those lines, allowing them to have further funding for other, whether it's services or therapies or whatever it may be, then that's something that is, definitely a benefit. And it keeps individuals in the least restrictive environments. Again, always tying it back to that home and community-based services mantra of least restrictive person-centered planning. So this kind of self-explanatory, but there's two things we look at when we talk about remote supports. We have event support versus scheduled support. And I thought it was just important to just note the difference here. So event support, kind of what you think it'd be. It's, a window sensor goes off, a door sensor, something unexpected happens, emergency response buttons pressed, something along those lines. First, what we call scheduled support, which is, maybe a medication dispenser. So at 8 p.m., Greg has to take his medication. He goes, logs on, talks to, so-and-so, takes the medication, and done. So that would be something that's scheduled. So we call it scheduled support. So just important to make the difference. Also, something else I like to point out is I personally, when I first heard of technology and trying to incorporate it, I started to think, okay, like a Ring doorbell, maybe a sensor here and there. But really, you can see from the picture, you can have a different piece of technology in almost every room of the house, and it could be really beneficial for the individual, especially when we look at, trying to keep that autonomy for them. Okay, so how does remote supports, how does it work? So let's pretend let's say like a CO alarm went off in the person's residence. So the sensor alarm sounds. From that alarm, a wireless, again, keyword, notification is sent to a remote support vendor. That vendor then identifies the remote support staff who's supposed to receive that notification. So again, those three steps are something that would be outlined with the IDT and agreed upon with the individual. That then staff or family member, again, it could be somebody paid, it could be somebody unpaid, basically has three options. They could either contact the individual or the provider and render guidance. They can contact an agency or an identified support, or they can contact emergency services. So whether that's the police or EMS or whatever, may be required at that moment. Okay, so some of the different roles and responsibilities for, the stakeholders in this. So first and foremost, obviously the individual, they really need to direct and develop the person-centered plan, central primary voice for the entire planning process. We really look at them to identify needs and outcomes that may be met through using this technology and remote supports. Makes decisions on the type of supports received, really based on conversations that they have with the IDT and their supports, and they remain the primary voice through the implementation, ongoing use, and hopefully eventually phasing out of the technology. Family, guardians, and friends. So those that are fortunate enough to have, what we can call it informal, so unpaid support system. Um, it's really important for them to support the individual's decision to use technology and remote supports. We hope that they would work with the IDT to ensure that, everything is being delivered appropriately and report any issues that may come up. We look at them to kind of monitor the use of the tech as it phased in and on an ongoing basis. And I know I kind of just hit on this, but report any concerns around that tech to the IDT, immediately. Provider agency. So the daily rate example. So, we're going to assume that, we're talking about a group home for this scenario here, or any residents that receive the daily rate. I believe supervised apartments and so on could also qualify, and CCR providers. So providers provides all services as identified by the IDT through the person-centered planning process. The provider would help to identify opportunities where remote supports could be utilized. And the provider provides ongoing monitoring for any health and safety concerns. And again, this is the same for all of them, immediately notifies the IDT with any concerns or challenges. So really, you can kind of see like the focus of all these bullets for this one, the last few, and I think the next screen too, really focus on having enough eyes on the individual, ensuring that tech is working appropriately, is beneficial, and is helping to keep the person safe and healthy. The support coordinator. So the support coordinator is the entity responsible for facilitating the person-centered planning process, assuring the individual understands and agrees with the services being provided through tech, documents everything in the ISP, PCBT, NJCAT, so on. I'm sure I'm forgetting some acronym of a plan that we have. And then the support coordinator, and again, this is preliminary, which is why I put it in red. But what we're currently thinking is they're going to be the entity that completes the enabling technology remote supports assessment request and submits that through iRecord. They're currently the entity that does the assistive tech request, and they're also the only entity that has access to iRecord right now. So if that was, if we ever expanded access to providers or whatever it may be in the future, it might be something we can revisit. But for now, they are the only stakeholder with access. Okay, so how does the authorization process work? What we are really trying to do with enabling technology is to kind of clean it up a little bit and use assessments and tools that we already have at our disposal. Sorry. So the first part is we would look to complete an unsupervised time assessment, right? If the person doesn't have any unsupervised time, we might be a little bit more hesitant to look for a technology as a solution. After that, the IDT must agree that remote supports are appropriate, meet the individual's needs and goals. A backup plan should then be written. So that would include what person or agency will be monitoring the individual, steps taken in an emergency prior to the start of service. So again, I know I stressed this on the last slide or a couple slides ago. We understand tech fails, so we need to make sure that there's multiple backups in place, keeping the individual safe and healthy. Participants and guardians must have an informed choice to use remote support. So if it's in a group home, again, I'm just kind of going back to that group home example, all impacted residents and guardians must be in agreement and ensure that their right to privacy will be maintained. That's actually kind of the stage we're at right now, where we're really looking into how we could do that, what needs to be done. We're thinking some more conversations with CMS around that is going to be needed. I know video cameras is always a big question that comes up, and I wish I had a good answer for it, but right now it's just something we're having. It's definitely ongoing conversations around it, and it's waiting on more input from CMS as well. And when I say video cameras, I mean in places like a bedroom or something where it might be considered an invasion of privacy. And a remote support vendor should be chosen, and the support coordinator would then submit their paperwork to the division. So that would be, the final step in the process. Okay, so The form on the left is actually the current AT form. To be honest with everybody, I think I copied the wrong one. So when I send out the slides, I'll put a sample of the enabling tech one that we're working on. Again, it's not a finished product, but at least you can have an idea of what it looks like. The AT one will kind of give you a general sense of, but basically when requesting technology or remote supports, we would look to complete a screening tool, request form, to determine that the individual provider are in agreement to move forward. Again, the support coordinator would then submit the request to the division for review and approval. The individual would conduct an IDT with the vendor, review the approved service. We would look for the vendor to set up and install any supports in the home to ensure that they're working properly and that they're, there's some kind of linkage with their system that needs to be done, that they're there to ensure that that's connected. We would then look for the IDT to have, an initial meeting to complete any trainings and then ongoing meetings, including an annual review of the tech. So we want to, again, make sure that we have multiple eyes on the technology, especially during startup when we're all sort of getting used to this, this new tech. So how has this already been implemented? So Bancroft launched a smart home project. It's a few years now. It's been open. The goal was to enhance safety, independence, and quality for individuals, quality of life, for individuals residing in their what they call smart group home. So some of the key features, and these are items that you would recognize from previous slides, are the smart sensors and devices. Again, they're customized to meet individual needs. It can, and it currently does, include biometric locks, safety sensors, and smart appliances. Assistive technology. So again, this is stuff that it's currently already utilizing. Voice assistants. So think Alexa devices, smart lighting, Alexa, turn on living room light. Alexa, turn off living room light. And medication dispensers that promote autonomy. Staff support tool, so it allows remote monitoring and alerts to assist staff in providing timely care. So what's some of the impact? It's increased independence. Residents can perform daily tasks with, less we used to call it hand over hand assistance from staff. It's enhanced safety. So it's proactive alerts, reduce risk and improve response times and workforce efficiency. It streamlines, certain tasks, thus allowing staff members to really focus on other staff and we would hope personalized care. So how did this come about? So initially, I believe the initial request, and I'm sure this is public record, was, I want to say, don't quote me on this, for $1 million. I think they were eventually awarded $500,000 from Human Services. They also worked in partnership with local officials and their community members to kind of get this off the ground and rolling. Okay, so how does this all kind of fit into our waiver and what we have and kind of what is our initial thought on this? So as of this moment, we do not anticipate requesting an amendment to our 1115. What we're looking to do is have enabling technology be built into the second code you see here with the 22 modifier at the end, and for remote supports to be built into the 2029 HI that you see on the bottom there. Again, the descriptions we can, that's something that we can change, as needed. So if we wanted to change the tech, enabling tech, whatever, it may be, we can look at that. The one caveat with this is so not making any amendments to 1115 is something that we thought about, and other states, from speaking with them, have also tried to do. Some, it seems like, are still in discussion with CMS about it, while other CMS offices have said, no, this needs to be a standalone procedure code. So again, our initial thought is that it would make more sense for us to tie it in. But if our CMS office decides that, it needs to be its own standalone code, then that's, obviously the route that we would need to take. Okay, so just some quick example costs. So some sample rates from Oklahoma, remote support services. So paid backup, we're looking at $3.28 per 15 minutes. Unpaid, $1.81 per 15 minutes. Gray Matters is they're a national provider. They only provide the tech, so you wouldn't see like the remote supports through them, but they have software, their own software license and renewal that they use with an initial upfront cost of $3,500. And then any kind of technology that they incorporate into that. So it could be Angel Sense, CO sensors, whatever it may be, video doorbells, and so on. And then there's a monthly service rate of $350. Safe in-home costs. This one provides tech and remote supports. The initial cost includes charges for the selected technologies. They actually lease their technologies rather than allow the state to buy them outright, so it's a little bit cheaper. Monthly service charges for them range from $35 to $110 per month. So you can see it's a pretty big difference between Gray Matters and them. So it's, we're going to have to kind of look into, what the difference is a little bit deeper when we get to this point. And then the service charge also kind of depends. Well, the 35 to 110 range depends on what the technologies you choose to utilize. THS, and I apologize, I am blanking on what the acronym stands for, but their initial cost includes charges for the selected tech, and it can vary. Monthly service cost is $76 per month, so kind of in the middle of that safe home range. And again, depends on tech chosen. Dose Health was the only item that they use as a medication dispenser, and that's $60 per month. So you can see it kind of varies rate to rate and tech to tech and program to program, and it's something that would need to be explored with the IDT and so forth. Okay, so this kind of speaks a little bit more to current assistive tech and some denials. And if there's any questions about this, Esther, when we're done, Esther would be the subject matter expert for them. But just so you have an idea, like why might the division deny technology? A lot has to do with our assessment. So if the New Jersey CAT indicates that speech is readily understood by others, but you're asking for a speech device, that would be an issue. If the New Jersey CAT indicates that an individual does not utilize a wheelchair and demonstrates no mobility issues, but you're asking for, something along, something that has to do with mobility, it's not lining up. The assistive tech environmental modification form might be missing or submitted incorrectly. Something I touched on earlier, the individual resides in an apartment. So if that's the case, we do need a written letter of permission from the landlord, which needs to be in our files. We've seen a lot of incorrect assessment fees, durable medical equipment, full house generators. These are items we don't look for. And then I'm not sure if everybody's aware, but vehicle modifications actually have a separate procedure code, so they wouldn't fall under, what we call assistive tech. Okay, so the next, I believe it's like 2 slides, kind of talk about, where we're going with this. So, currently we're meeting with a group of, we call it the consortium of technology. It's a group of member states who are looking to be tech first and sort of be in the driver's seat for technology and incorporating it into the lives of individuals with various disabilities. I don't remember how many states there are here. You can see from the list, it's probably about 30, I would guess. We were actually one of the first ones involved in this when we actually started. I think there was 3 or 4 other states. I want to say Oklahoma, Tennessee, say Illinois too, probably Maryland. We're sort of the first 3 or 4 there, and then we kind of joined in, and it grows pretty much every month. That we're part of it, and again, it's really cool to see like this tech push coming in throughout the country. So what are our next steps? We're going to continue to meet with the consortium technology that I just spoke about. We continue to meet with stakeholders, advocacy groups. So, we've done a few webinars around this. We plan to probably do a few more, and we'll kind of go from there. The assessment. So, we might look for comment on the assessment form to make sure it's, simple, straightforward, and, user-friendly. And then, when we eventually go live with a lot of the stuff, we would look to do identify a pilot group for an initial application to work with. And like I said, I know a lot of providers are already using some of these items in their residents, especially like the Ring doorbells and medication dispensers. So, we can kind of talk about, the pilot group when we get to that point. Okay, so again, I'll stay on here now to, we can answer any questions, comments, concerns. But if, like I said earlier, if you're like me, you're gonna think of something the second we hang up. You can email. Email is the best way to get me. You can see my email on the screen here. If you prefer to talk by phone, you can give me a call at that number, and then they can, page me as needed. So I'm gonna stop sharing so I can see if any questions came in here. Sorry, I'm not completely used to Zoom. Um,
I have a few
okay,
questions.
okay.
First of all, thank you so much for the presentation. It was very informative and really exciting. We have, how often do the sensors and the assistive technology need to be updated?
It's, so just to confirm, when we say updated, do we mean renewed in the plan, or are we talking about like
I think
software updates?
replaced. Yeah,
Oh,
like due to
okay.
age or
Yeah, so I think for each piece of technology it's going to vary when, what the lifespan looks like. But that's something that when we talk to these provider agencies like a gray managers, that's their responsibility. It's something that they would need to ensure is working, especially since we're going to be paying for it on an ongoing basis. And I see Catherine, can you put your email address again, please? Yes, I'm gonna put it in the chat so this way anybody can just cut and paste it and make it easier. Okay. Sorry, Aaron, I'm not seeing the questions. I see a
oh,
chat.
they were sent to to me.
Okay.
The leisure items, are those often covered by insurance?
So I think again, it's kind of like item specific. I think Esther might be able to kind of elaborate on what we currently look for, but like with the um with God, I wish I remember now. It's like a portable blood pressure monitor that an agency made for sports, which I thought was like really unique. What it did was it obviously it couldn't give an accurate reading, but it would look for spikes and abnormalities so that an individual who normally wouldn't be able to play sports could use it. So it's something that would be covered um, under our enabling technology umbrella. But I don't think, and Esther, what are your thoughts on it? Like, I don't think that would qualify for like DME,
No,
something
that
like that.
actually wouldn't.
Right,
But there are things there's a lot of crossover in there. But there are some things that insurance would cover. So it really comes down to number one, will insurance cover it? Number two,
right,
is it DME? Or can we somehow, make it fall under the AT umbrella?
right. Thank you, Esther.
Excellent. And then uh, if something like video cameras are installed, do the individuals have access to the recorded information?
So currently, video cam there's no video cameras aren't permitted in certain areas of the residence currently, right? Like bedrooms, bathrooms, and so on. Um, Cameras, it's kind of like its own animal. We're working with CMS to work through that. There's no rules around it. Like we don't have any criteria about who would be able to view it, how it would be stored. These are all questions that are currently being discussed and addressed. So unfortunately, I can't give you a concrete answer for that.
Okay. Is there an appeal process for denials?
Yes, yes. So if let's say that an insurance company does not consider whatever you're requesting to be durable medical equipment. So it could fall under the assisted tech umbrella, but for whatever reason, and there's again a multitude of them, we would deny the product or whatever it may be. You would be granted fair hearing.
Excellent. And then I have, is training included on how to use the devices as well, and whose responsibility would that be?
Yes. So training is obviously a huge component of it. When we've been meeting with the national providers of this tech, uh, something we've been stressing is that we would expect, if we're going to use them in New Jersey, that they provide any necessary training to use the technology. A lot of them, honestly, it has not been an issue because they all have their own proprietary software. So it's their own unique system. Like they don't use, um, like a Ring doorbell. Like they don't use Ring system. They have their own system that they've developed and used. So the training aspect is on them. Um, kind of. So I think that answers that question. But just kind of piggyback on that a little bit. We do anticipate also having state staff trained. So there's what states call tech champions, and there's a national accreditation that you know state employees can get around technology, and it would help them to be able to take part in some of those trainings, to address questions, and to really like look at, if an IDT comes back and says, hey, we really don't know what's appropriate, we don't know what's out there, maybe can you kind of help us? We can have that tech champion reach out and kind of provide that support. So again, I know that wasn't your question, but I just wanted to throw that in there.
So I have a question too. When a vendor is chosen and like they're the response team, do like state staff like DSPs, are they ever part of that response team as well? Like
So it's unique to the
immediate
individual.
response.
Yeah, it's unique to the individual. So we have a piece of technology, say like a sensor goes off, it goes to whatever vendor we're using. Um, it's then the responsibility of the IDT to determine what that vendor should do. So that
Okay.
vendor could call the DSP, they could call, so that's why we say paid and unpaid. They could call like a family member. It's whatever the IDT determined would be the course of action should the CO sensor go off or a door sensor go off. It's unique to the individual.
And then I'm not sure if you can answer this, but if a person has a guardian, is the person still involved in picking the vendor and picking the items, or is that solely on the guardian?
Oh, no, no. Yeah, it needs to, the individual needs to be included to the, extent of their abilities as much as possible. I'm assuming everyone on here is pretty familiar with, home and community-based services and the rules around that, and really focusing on person-centered planning. So yeah, it's not just the guardian saying yes and no to whatever, item or tech or remote supports they might need. It's, really the entire IDT meeting and working through it. And that's something that we need to ensure when we are looking at the assessment, when it's finalized, that we can pull that out, that the individual had, input to the extent of their ability in the planning process.
Excellent. That's all the questions that I got, but if anybody else has any questions, please feel free to put them in the Q&A box or in the chat box, or like Greg had said, I'm the same way too. As soon as the webinar is over, I think of a million questions. Feel free to reach out to us or to Greg. Greg's email is in the chat. And I'm not seeing any other questions. So I just want
Okay.
to, again, thank you so much for coming and presenting. Thank you, Esther. And
You're
it
welcome.
was great information. This will be recorded and put up on our website as well. You will get an email, a follow-up email tomorrow with the certificate of attendance, as well as a link for the slides and the presentation. So thank
Thank you. Thank
you.
you, Aaron. I appreciate you having us. And, please don't hesitate to reach out. This is one of my passions, and I'd love to hear, you know, different ideas and just have discussions around this. So don't hesitate to shoot me an email.
Excellent. AT is fascinating to me, and I'm always learning about new items of technology that are available. So I love this. So I really appreciate you guys coming out. Thank you so much. And thank
Thank
you
you.
everybody for participating. Thank you all so much. I hope you have a wonderful rest of your Tuesday.
Thanks. Bye-bye.